So let's take a look now at how the numbers have changed in the last 2 weeks. So again, this slide presents to us the case rate in Santa Clara County. The information can be found on the Santa Clara County Public Health Department's website. And this is information as of January 21. So for our vaccinated residents, the case rate is 186 out of 100,000. And that is up 96 from 2 weeks ago. For unvaccinated, the case rate is 976.9 out of 100,000. That is up 664.4. We have a vaccination clinic coming up on February 5th at Willer as well as at Rancho. I do encourage members of our community to take advantage of those clinics if you haven't already. And the clinics are available for children ages 5 and up, adults who haven't had their vaccine yet, as well as those ages 12 and up who are ready for their boosters. Overall, our case rate is 240.6 out of 100,000, which is up 120.8. Here is our data in Santa Clara County on vaccinations. The vaccinations for 5 to 17-year-olds is up 3.3%. For those who are eligible for the booster, that number is up 2.8%. And for all ages, vaccination is up 1%. These are our COVID case rates here in our district. The box on the left is the case rate from last week. From 2 weeks ago, January 7th, the last time I reported. And the box on the right is the data from this past week as of January 25th. You see that we are up about 200 points. And this does not include those cases that were reported to us by parents. There's 172 cases that have been reported by parents. The case rate that we report on our dashboard is those that we identify through our own testing. I'd like to share also the change in the fill rate for the number of substitute jobs. Again, these are substitutes that are directly impacting the classroom. So that would be teachers, certificated specialists, as well as classified support teams, such as our behavioral intervention specialists and our paraprofessionals. So while the number of sub jobs has declined, what I'd really like to point out is that the fill rate has increased. So the fill rate increase could be attributed to the fact that our HR department has been heavily recruiting, and with the increase in our pay rate, which Assistant Superintendent Brunson has shared with us in the past, is quite a bit over many of those that we are competing with. And in addition to that, it reflects the slowing of COVID and that we are potentially at our peak. Over here on the last two columns, you see our student attendance rate where the yellow arrows are. Again, we have the average for the same point in time from 2017 to 2020 prior to COVID. And you see that for this past Friday and Monday, our percentage of attendance is less than it was in the 3-year average. You'll also see that our total absences is greater than it was for the 3-year average. And in addition to those absences that you see there, the 550 for Friday, you would add 218 absences due to COVID or COVID quarantine. And then for the 481 for Monday, you would add to it the 158 COVID absences due to quarantine or illness. With the surge, several protocols have changed. One of them is the request that we have made, the expectation we've made to all staff members as well as our students, which is to wear the most effective masking that they can. So that means for those who prefer to wear a cloth mask, that they double mask. Otherwise, using one of the better protections, such as a surgical mask or the N95, KN95, or KF94. And you see also that double masking is about as effective as one of those masks. We have received from the state KN95s for all staff, as well as high school students who would like them. We have also ordered surgical masks for all other students. Our testing procedures have changed due to the surge, and we sent out parent notifications the day after Martin Luther King Day. And we also have posted on our website the letter that Dr. Marianne Dewan, Superintendent of the County Office of Ed, submitted to all 31 schools in the education community, explaining that during the surge, we would cease individual contact tracing, and districts are provided the opportunity to either do one of two other notifications, because individual contact tracing is not the way to handle the surge. One avenue is to simply do a single statement to all staff, all students, and their families, that because of the surge, nearly every one of us is a possible exposure, and to be careful and watch our symptoms and to get tested. Part of that also would be that we would want to make sure we are providing weekly testing opportunities to families in a variety of ways. In addition to those that we can offer through the school, also taking into account the attestation document that parents can now use for testing at home, as well as our community tests. The other way, which is the way that we chose to go in Milpitas, is to do group contact notices. So when we have a COVID case in a classroom or at a middle or high school in a group of classrooms, every student who is in the class of the person with COVID, as well as staff members, will receive a notice called a group contact exposure notice. This means that you watch for your symptoms, and that we will first test all the symptomatic who are on campus at that time, as well as the rest in the group to the best of our ability. The testing should take place on day 3 and again on day 5 after the exposure. I do have to say that we still do not have enough antigen tests in order to test everybody as needed. We have put in orders, as you know from prior board reports, for antigen tests. We met yesterday with Dr. Dewan and her team about how we might be able to procure additional tests through a program called CLIO at the state level, and we are investigating that. And also the County Office of Ed is working to procure tests that they can then provide for at cost to all of the school districts. So we are still diligently looking at how we can build capacity for weekly testing of all who want it. I must say that I am very appreciative of the work that each of our staff members has done, especially in these last several months, because our approach is really something that the healthcare system should be doing. And we in education would love to be able to focus 100% of our time on education, but safety is first. And as a safety first district, we are dedicated to doing all that we can to provide support and mitigation for COVID. And we do recognize that we need to work in partnership with our healthcare providers. But I just want to point out that our first priority is education. And with COVID, we've also become an extension of the healthcare system.